Evidence-based practices are those that are tested and proven to be effective. Bonnie Stewart explains that some of the evidence-based practices, what some of the evidence-based practices are at Mount Regis and how they work.
Evidence-based practices are those that have been researched and there's a consistency in the positive outcomes that they do work.
So when people come to Mount Regis, they're entering into programs that have been tested.
That's true. Evidence-based practices includes things like cognitive behavioral therapy, family therapy, motivational enhancement, incorporating the 12 steps into programming. And another thing we do that's really unique is that we have primary track and relapse track. So when someone comes in and they're a primary patient, haven't been here before, they would get different assignments from one area, and then if the person has been here and it's a relapse, they would get another assignment. So they get a lot of the same things, but it's individualized based on where they are in their stage of change.
And that's really good too, because each person is different and they have different needs.
That's so true. That's so true.
And why is it important to you at Mount Regis to do things that have been evidence-based and that have proven to work?
Well, historically, the outcome for substance abuse treatment has been, like, oh, people relapse. Mm-hmm. But you can't really base it on whether or not somebody relapses. We have to base it on movement from one level to another. They may come in and they're just not even really thinking about changing. Mm-hmm. So if you can move somebody from that to actually working on it and changing, then that's progress, and that's a success.
And that's really what it's about, more so than just fixing an addiction. It's about fixing the heart and the mind of the people who come in here.
It is. Very holistic approach. It's all about body, mind, spirit. We do a lot of those kinds of things, too. We don't just look at the addiction.
Because somebody really has to want to change to be able to change, right?
Well, that helps. But initially, when most people come to treatment, they don't really want to be here. Nobody wakes up and says, oh, I think I'll go to treatment today. So part of what we do using evidence-based practices is moving that person from ambiguity to maybe moving past that to getting where they want to do treatment. Then they can start internalizing what they learn, and then when they take it out with them when they leave, it's much more successful.
And we've talked about this before, that sometimes the hardest part when people are struggling with an addiction is getting that help. And like you said, a lot of times they don't want to change, and maybe it's a family who's reaching out to get help. So what would you say to people who are maybe watching this that are like, what do I do?
For family members, just be firm and say, hey, I can't tolerate this. You need to go to treatment. You can always call, and somebody here can give you pointers and help you with what to do. You can get intervention specialists to come in and help, but the big step is getting that person to take that first step and come to treatment.
And the people here, the staff is so nice. It's not a scary thing.
No, we're pretty laid back here. Yeah, like a family. It's a very nice place.
The Mount Regis Center is located on Kimball Avenue in Salem. For more information, you can call 540-389-4761, or you can go online to mtregis.com.